I'll get right into the point. Diffuse unpatterned alopecia, also known as DUPA, and retrograde forms of hair loss, in my opinion, are more so aesthetics rather than conditions in their own right. This means that people who present with DUPA and retrograde may have similar distributions of hair loss, but their underlying reasons may differ. This is important in some cases because finasteride and dutasteride simply will not work, or at least on their own. To illustrate my point, imagine two people, person A and person B, both missing their right hands. At first glance, their condition might seem identical. However, close examination reveals significant differences. Person A, for example, lost their right hand due to some sort of an accident. An X-ray would show jagged bone ends and possible signs of surgical interventions like pins and plates. There might also be scarring and bone remodeling around the stump. In contrast, person B was born without their right hand due to a congenital condition like phocomelia, where limbs don't develop properly during fetal development and results in stump or flipper-like appendages. Their X-ray would show naturally tapered or underdeveloped bones with smooth contours and no signs of trauma or surgery. Genetic testing would confirm the congenital defect in person B, but not in person A. This distinction that we can see here highlights that an outward appearance can sometimes be deceiving. Should we describe the individuals, this person A or person B, having something called missing right hand syndrome? That's just the aesthetic. That's just the appearance. The more accurate thing here to do would be to say that person A is an amputee and person B is just someone with a congenital condition, particularly in this case that I'm giving the example of, phocomelia. Now, let's apply this logic to hair loss, right? Androgenetic alopecia can appear in various patterns, including diffuse unpatterned alopecia, so DUPA. You could have a DUPA that is based in the pathology of androgenetic alopecia. So meaning that DUPA that somebody has, that sort of outward appearance of a diffuse pattern, could be due to a sensitivity of DHT, and this could very well just be a pattern that's being exhibited. The same could possibly be said for a retrograde form of alopecia. Because Hamilton's classification of common baldness, Byung-Jun Kim's modification of that Hamilton-Norwood scale, turning it into the basic and specific classification system, and Kamisha et al.'s research on androgenetic alopecia progressions show that androgenetic alopecia can be diffuse or localized to specific areas of the scalp. And that being said, it wouldn't be without reason to say that some patterns are more rare than others, but still the underlying sensitivity or the underlying issue here is that sort of genetic sensitivity to DHT in the scalp hair follicles. So, in other words, if you have DUPA or retrograde alopecia, it could just be plain old androgenetic alopecia. But at the very least, this needs to be fully confirmed because you could have comorbid causes of hair loss caused by other issues. And this is where scalp biopsies are important. So pay attention to this section because this is where you should be getting a scalp biopsy. I'm just going to come in and spoil what I'm going to be talking about in this sort of video, but scalp biopsies will tell you what you're dealing with. So if you're listening to this right now and you want to, just find out what you should be doing, go to your dermatologist and urge to get a scalp biopsy, especially if you've been getting worse while on dutasteride and let's say something like even oral minoxidil. You're using both of those together and you're confirmed getting worse, right? You're doing the trichology reports and tests. You're getting your scalp looked at with a dermoscope. If it is confirmed that you're getting worse or you have any suspicion that it's getting worse, then go get a scalp biopsy. Stop messing around, stop coping about it, urge your dermatologist to do it because that's the only way to know what's going on, right? Again, I'm spoiling the video. I'm actually just talking off a script right now because I want you to understand this part in case you're going to skip around. This is what you need to understand, right? Because in a scalp biopsy, okay, they come in, they cut out 4 millimeters of your scalp tissue, and then that area is replaced with scar tissue, right? Okay, you're going to freak out about that. I don't want any scar tissue. But think about it like this, right? You're losing about 40 hairs to tell you the fate of about 50,000, right? So the knowledge you get from that will help you proceed with more effective treatments. So please don't, give a headache in the comments and stop complaining. This is for your own good. So just go figure it out and go do that scalp biopsy. But anyway, let's get back to the original script of the video.